Welcome to Medicare 101. This video series is built for you to help guide you through the Medicare process, help answer some questions that people have when they're going through the Medicare process, and help you avoid some of the pitfalls as you're going through the Medicare process. Our first video is called What is Medicare? We're going to introduce you to Medicare, what it is, and what it covers. So, what is Medicare? Medicare is the federal health insurance program for people over 65, as well as people under 65 with certain disabilities, permanent kidney failure, or ALS. It consists of four main parts known as Parts A, B, C, and D. Parts A and B are known as Original Medicare. These are run by the Social Security Administration. Parts C and D are run by private insurance companies. So let's break down the parts a little bit for you. Starting with Part A. Part A is known as hospital insurance. It covers inpatient hospital care, skilled nursing facilities, and that sort of stuff. Part A also helps pay for some home health care and hospice care. Part A is usually free to anyone who is paid into Medicare for at least 40 quarters or 10 years. That's through your job. They withdraw taxes. One of those tax items that they usually withdraw on your taxes is for Medicare. So as long as you've paid into Medicare for 40 quarters, Part A will be free for you. Part A does have a yearly deductible that must be met before it covers hospital stays, and it limits how long of a stay in the hospital it will cover. On to Part B. Part B is known as medical insurance. It covers medically necessary doctors, services, outpatient care, home health services, durable medical equipment, mental health services, limited outpatient prescription drugs, and other medical services. In short, it's your day to day coverage. It covers your doctor visits, your checkups, that sort of stuff. It also covers your preventative services, such as your annual vaccines, annual checkups, that sort of stuff. Part B does have a standard monthly cost that is based on your income. Most people pay the standard monthly cost, but if you make more money than most, you may have to pay a higher premium. Part B also comes with a deductible that must be met each year. A few important things when talking about Medicare Part A and B. Parts A and B only cover about 80% of medical treatment after the deductibles are met, and they don't include coverage for dental, vision, or prescription coverage. As a result, it's usually advisable to obtain some sort of supplemental coverage, either through Part C, which is known as Medicare Advantage, or a Medicare supplement plan known as Medigap, as well as getting a prescription drug plan through Medicare Part D. Medicare Part C, known as Medicare Advantage, and Part D, known as prescription drug coverage, will be covered in separate videos because there's a lot more detail involved with them. So we won't cover that in this video. So the next thing to cover in this video is, when do I get Medicare? A lot of people don't think about Medicare, especially if they have job coverage. So there's certain situations where you may not get Medicare at age 65 like normal. So we just want to talk a little bit about, when do you get Medicare? Generally, you become eligible for Medicare on the first of your 65th birth month. Your enrollment period starts 3 months prior and continues 3 months after your 65th birth month. You may also be eligible for Medicare if you have end-stage renal disease. You qualify for Medicare on your 4th month of dialysis. So that is when your Medicare would start if you have end-stage renal disease. If you have Social Security disability income, once you receive Social Security disability income for 24 months, you'll be enrolled in Medicare Parts A and B. And then finally, the qualifier for Medicare is ALS, also known as Lou Gehrig's disease. When you start receiving disability payments for your ALS, you will automatically be enrolled in Medicare Parts A and B. Some very important things. If you qualify for Medicare at age 65, it's important to pay attention to your qualifying period. Parts A, B, and D may carry an additional penalty if you don't enroll in them when you're first eligible. So, unless you have other qualifying coverage, such as a job or a union coverage, then you need to pay very close attention to those enrollment periods when you turn age 65. Medicare can be a significant transition and usually works differently than most insurance that people are used to. So, we highly recommend that you walk with a trusted Medicare professional throughout the process to help make this transition as smooth as possible. If you have someone local, we highly recommend finding somebody local. We'll talk a little bit about that search later on in another video and some things to avoid when searching for help on Medicare. If you don't have anybody local that you can trust, feel free to give us a call. We're always happy to help guide you to somebody local, or if we're licensed in your area and contracted in your area, we would be happy to help you as well. In our next video, we're going to be talking about the process of enrolling in Original Medicare, which is your Part A and your Part B. Thank you for taking the time to watch this video. I hope this information is helpful to you, and I hope this helps guide you through that first initial questions that you have on Medicare.